On behalf of Team VIAMS, we welcome one and all to today's webinar, VIAMS Approach on Parkinson's Disease Management. Myself, Dr. Sharanya, Resident Medical Officer, VIAMS. We are conducting this webinar on behalf of World Parkinson's Day, VIAMS Approach on Parkinson's Disease Management, presenting by Dr. Vijit KV, our Chief Physician and Managing Director, expert in Ayurveda, Neurology and Wellness. He is the torchbearer of the fourth generation of noble traditional Ayurveda family, Kalladathu Valappil. Dr. Vijit KV is a visionary with a sharp taste for innovation. We are conducting this webinar. He was solely responsible for bringing the idea of concept treatment and Dr. physician preparations in his ideology. Innovation never stops. With Dr. KV Vijit brings is that the organization is eligible. Dr. Vijit KV is a visionary with a sharp taste. I'll give some light to Ayurveda, the wisdom of life. Ayurveda, a complete medical system which perceives that ultimately all intelligence and wisdom flows from one absolute source, that is Paramatma. Health manifests by the grace of the absolute, acting through the laws of nature, Prakriti. Ayurveda helps nature by promoting harmony between the individual and nature by living a life of balance according to their laws. Ayurveda is considered as the wisdom of life, was practiced in Indian region more than 5,000 years ago and is also called the mother of all healing. This system of healthcare believes in 5 basic elements, that is Pancha Mahabhutas. They are space, air, fire, water, and earth, which manifest in the human body as 3 basics. Humus. They are Vata, Pitta, and Kapha. Each person is born with a unique combination of these doshas, which decides their basic constitution called Prakriti. We all have different balance of energy. Ayurveda shows that the path to optimal health is different for each person depending upon their body constitution, that is Prakriti. I welcome Mr. Ratish Manoharan, Director Operations. He will introduce our VIAMS, our healthcare unit. Please, sir.
Dr. Vijit, humble request is there.
Good evening all. Myself Pradesh, Director Operations VIAMS. I would like to introduce our organization to you guys. Our organization VIAMS, Institute of Ayurveda Medical Science, carries a legacy of 4 generations in traditional Ayurveda healthcare. We have established in 1972 as a Vaidishala, a traditional healthcare clinic in a serene village, Merathur, Palakkad, Kerala. We are blessed to be nestled here because the place Merathur itself has a legacy and history of Ayurveda practice. VIAMS is admired in providing holistic treatment based on Ayurveda with the integration of allied healthcare techniques such as physiotherapy, psychology, yoga and meditation, audiology, speech language pathology, nutrition and dietetics, etc. So to lead a healthy and peaceful life with Ayurveda. The Institute, VIAMS, was established in 1972 by late Dr. K.V. Vijayan as a Vaidashala, believing in holistic treatment of ailments without inflicting any side effects. The Vaidashala followed the 5,000 plus years of old discipline, Ayurveda, an ancient wisdom of healing and longevity, which is transformed. The dynamic leadership of late Dr. K.V. Vijayan was unparalleled. His vision carries forward by his son, Dr. Vijit, with more than a decade's experience and proven management and leadership skills. And he brings his vision, inspire well-being, to our group. Now, VIAMS Healthcare is into hospital and clinics, Ayurveda medicine manufacturing, wellness centers, and an academy. Our business units to achieve our vision are KV's Pharmaceuticals, Ayurveda Medicine Manufacturing Unit. We are the first GMP certified company in the Palakkad district, Kerala, and the third ISO certified in Kerala state in its class, where we prepare very authentic Ayurveda medicine formulations. And Mitra Ayuspa, the wellness division of VIAMS Group, where we can experience Ayurveda rejuvenation treatments with blends with contemporary spa methods. And we have academy division where we would master in healthcare knowledge.
Thank you, Ritesh Manoharan. I believe we could give a basic awareness about VIAMS and Ayurveda system of medicine. I welcome Dr. Vijit to continue today's section, VIAMS approach on Parkinson's disease management. If you have any queries, we address at Q&A section by the end of the section. You can note it down and ask at the chat. Sir, please welcome and please.
Thank you, Dr. Sharanya. Good evening, all. Thank you, Dr. Sharanya, for the wonderful introduction, and thank you, Mr. Ritesh Manoharan, for the wonderful introduction about the VIAMS. Once again, good evening, all, and welcome to today's webinar on our approach in Parkinson's disease management. As the time is pressing, I am straightly going to the presentation. Today's session is about Parkinson's disease. So, what is Parkinson's disease? Parkinson's disease is a progressive degenerative disorder of central nervous system affecting the motor and cognitive functions. VIAMS conception of Parkinson's disease as Kampavada. Kampavada is mentioned in Ayurveda text. So our conception of Parkinson's disease is Kampavada. Ayurveda envisions the human body as a congregation of three basic humors namely Vata, Pitta, and Kapha. Vata is the entity concerned mainly with the control and coordination of our body by maintaining all kinds of movements and thought processes. Aggravation of certain qualities of Vata presents as tremors, imbalance, cognitive impairment, etc. Thus, correlate Parkinson's disease to such an exaggerated condition of Vata called Kampavada. Karapada tale kambe, deha brahmana dukkide, nidra bango madikshina, Kambavadasya lakshanam. This is a quotation of the Kambavada mentioned in Basavarajiam text. Basavarajiam is an ancient Ayurvedic manuscript or Samhita, which is supposed to be written in 16th century AD. In the 6th chapter of Basavarajya, it is mentioned. And this is a Sanskrit sloga I mentioned. And I will translate that Sanskrit sloga as shivering of palm and soul, vertigo, severe grief, loss of sleep, reduced confidence are the symptoms of Kambavada. This Kamba means tremor, that is shaking, and Vada I had already mentioned. So this Kamba and Vada or Kambavada are mentioned in different Ayurveda Samhitas like Charaga Samhita, Susruta Samhita, Ashtanga Hridaya, Ashtanga Sangraha, Madhava Nidanam, Harita Samhita, Vangasena Samhita, Chakradatta, Sharangadara Samhita, Bhava Pragasha, Basavarajiyam, Vaisiddharatnavali. These are some of the texts which mention this Kamba and Kambavada. Now let's see how Parkinson's disease or Kambavada occurs. Well, progressive degeneration of substantia nigra is the main cause, which is a region of midbrain where dopamine is produced. So what is dopamine? Dopamine is a neurotransmitter which plays a key role in the execution of motor and cognitive functions. Dropping down in dopamine levels leads to cardinal symptoms like tremor, bradykinesia, and postural instability. So, shall I ask you, are we at risk? Do you think, are we at risk? Certainly not. But yes. Let's look into it. Do you know approximately 1% of people above 60 years of age suffer from Parkinson's disease globally? And recent observation shows a growing number of younger people, younger than 50 years of age, are being diagnosed with Parkinson's disease, which comes around 8 million of global population, even though we can control Parkinson's disease. Now let's discuss what would be the causes of Parkinson's disease. I will say it as hereditary, drug-induced, traumatic, chemical interactions, accelerated aging, and idiopathic. So what is hereditary Parkinson's disease? Hereditary Parkinson's disease can run in families as a result of faulty genes being passed to a child by their parents. I'll be more specific. Our possibilities are more to have Parkinson's disease in case if the parents, grandparents, siblings, or any blood relatives have any type of neurological issues, especially Parkinson's disease, progressive supranuclear palsy, motor neuron diseases, amyotrophic lateral sclerosis, dystonia, dementia, Alzheimer's, mentally retarded, etc. We have an experience in treating 3 generations of Parkinson's disease in our institute. Now, what will be drug-induced Parkinson's disease? Those who have the history of taking medicines for a year or more, mainly for neuropsychiatric problems, respiratory issues, gut-related problems, skin diseases, etc., may lead to Parkinson's disease. Next is traumatic Parkinson's disease. Anybody have any history of RTA? RTA means road traffic accidents, internal injuries in brain, or any trauma on head may lead to Parkinson's disease, and those are known as vascular Parkinsonism. The chemical interactive Parkinson's disease. Those who interact with chemicals, fertilizers, pesticides, or exposure to hot and cold climate may lead to Parkinson's disease. Accelerated aging. Those who have the history of surgical interventions like hysterectomy, hormonal therapies, chromosomal abnormalities, etc., may cause accelerated aging, and that may lead to Parkinson's disease. And the last but not the least, idiopathy, the most common, known as IPD, as the name says, where we couldn't find any clue which leads to Parkinson, will come under Parkinson's disease. Let's look into the signs and symptoms of Parkinson's disease. We can classify it into motor symptoms, cognitive symptoms, sensory symptoms. Motor symptoms are those symptoms related to any movements in our body, and cognitive symptoms are symptoms those related to conscious intellectual activity such as thinking, remembering, and reasoning. And sensory symptoms are related to sensation, conveying nerve impulses from the sense organs to nerve centers. Now, let us see, I will like to detail about the motor symptoms of Parkinson's disease. Cardinal motor symptoms, that is the main symptoms or the main motor symptoms are known as the cardinal symptoms, and they are generally or commonly known as TRAP. What is TRAP? In TRAP, T represents for tremor, R represents for rigidity, A represents for echinacea, and P represents for postural instability. So, tremor. I will detail the classification of tremor or different types of tremor. Rest tremor, kinetic tremor, pill rolling tremor, essential tremor. Hands or arms or legs are at rest, and when the muscles are relaxed, the rest tremor occurs. That means if we are watching television or if we are reading a newspaper, our mind will be into the television or the newspaper, and the muscles get relaxed. But the shaking or tremor will be on the hands or legs or any parts of the body, which comes under rest tremor. The kinetic tremor means tremors occurs with a single task like writing, usage of gadgets, trying to hold small objects are known as kinetic tremors. This may aggravate by mental stress. We can commonly notice while we try to put our signature. The next is pill rolling tremor. Tremors refers to the tremors of finger, usually the thumb and the other fingers, that makes it look as if the person is rolling a pill in the fingers. The next is essential tremors, involuntary or rhythmic shaking, which can affect any part of the body. The next in trap is rigidity or stiffness. The elasticity of the muscles become reduced and is known as rigidity or stiffness. The next in trap is akinesia. Akinesia means loss of ability to move the muscles voluntarily. That means that it's a freezed moment. We can say the freezed moment as akinesia. And the next is bradykinesia, that is a slowness of the movement. Normally, we can notice in the Parkinson patient. The Parkinson patient will start their walking with a normal speed. And even after walking a 50 or 100 meters of distance, gradually the speed of the walking gets reduced. And that is known as bradykinesia. And if the patient is completely freezed because of this slowness, and that frozen moment is known as akinesia. The last in trap is postural instability, which is self-explanatory. You can see that picture of that the picture in that slide. The patient may not have the proper alignment of the body parts, which may affect the performance of the work. There are more than 100 of motor symptoms, or we can tell more than 100 of motor symptoms. The trap is the cardinal symptoms or the important symptoms or the main symptoms we see in a typical Parkinson's patient. The other motor symptoms are micrographia. Micrographia means progression to progressively small handwriting. Masked face, loss of facial expression. That means the affected person to a fixed mask-like expression. Dystonic movements. Muscles contract involuntarily, causing repetitive or twisting movements. Stooped posture. I had mentioned that postural instability, we can correlate this postural instability with the stooped posture. That is, the body became less flexible and the muscles in the back became weak. Dysphagia, that is difficulty in swallowing. And dysarthria, difficulty or unclear articulation of speech. The signs and symptoms related to motor functions are not limited to these. Imbalance problems, muscle cramps, dressing difficulties, bedrolling difficulties, etc. are some of the common motor symptoms we see. So now we are moving to the cognitive symptoms we see generally in a Parkinson's disease patient. We can say generally the common cognitive symptoms seen in a Parkinson patient are depression, anxiety, apathy, psychosis, emotions, etc. Depression is a mood disorder that involves a persistent feeling of sadness and loss of interest. And anxiety is a normal and often healthy emotion. However, when a person regularly feels disappropriate levels of anxiety, it might become a medical disorder. Apathy is known as the lack of interest. Psychosis disorder is characterized by thinking and emotions that indicate the person experiencing them has lost contact with reality. And emotions, a strong feeling deriving from one's circumstances, mood, or relationships with others. Sleep disturbances is one of the major cognitive symptoms seen in Parkinson's disease. Daytime drowsiness, that is tiredness, fearful dreams. Fearful dreams is one of the major cognitive symptom or the sleep disturbances seen in not only Parkinson's disease, in any degenerative brain disorder condition, the sleep disturbances will be there. And fearful dreams is one of them. Somebody is going to attack or somebody is hiding in our room. Like so many fearful dreams will be there. And the next is hallucinations. Hallucinations are sensory experiences that appear real but are created by our mind. Loud noises during sleep. Monotonous soft voice, that is unchanging tone. Confusions, depressions, dementia, unusual fear, etc. are the cognitive symptoms. Coming to the sensory symptoms. In most cases where brain has trouble receiving and responding to the information that comes in through the senses, which comes under sensory symptoms and mostly affected to sight, hearing, smell, touch and taste. In Ayurveda, we will say it as Panchendriya or Panchendriya Apachaya. In sight, diplopia, that is double vision, delusion, that is imaginary vision. In hearing, it will be tinnitus or ear imbalance, that is vertigo. When it comes to the smell, imaginary smell will be there. Anosmia, anosmia means complete loss of smell. Hyposmia, reduced ability of smell. Coming to the touch, pain, pressure sensitivity, dysesthesia, that is abnormal sensation. Coming to taste, impaired taste will be there. That means that your sense of taste is not functioning properly. Hypogeusia, that is reduced ability to taste. These are some of the sensory symptoms seen in a Parkinson patient. And urinary incontinence, hypotension, sexual problems, constipation, fatigue, body aches, frequent falls, incapacitation, aspiration, bruxism are some of the common sensory symptoms and general symptoms, overall symptoms seen in a Parkinson patient. Now coming to the next session or the important session of this webinar. What is our objective? Our objective in the management of Parkinson's disease. As we all know, the brain cells or the nerve cells in the brain gets gradually degenerated. And because of that degeneration, the disease will progress and manifest as Parkinson's disease or any other degenerative brain disorders. So our primary objective is arrest further degeneration of brain cells. If we wish to arrest the further degeneration of brain cells, the quality of life, the betterment in quality of life will be there. And definitely these two will happen, the longevity will be there. So our objective is arresting further degeneration, thereby improving the quality of life and providing better longevity and regeneration of cells in possible cases, not in all cases. I had mentioned in my earlier slide that now a majority of the Parkinson disease patients are younger. Younger means below 50 years of age. With Ayurveda, we can regenerate the cells in such cases. Now, I had mentioned about the objective. Now I will detail about the approach, our approach. We can control or stop the progression of the disease by arresting further degeneration of brain cells with Ayurvedic medicines and therapies. Ayurvedic medicines is mainly used for internal purpose and external purpose used in Ayurvedic therapies. So Ayurvedic therapy, when we talk about Ayurvedic therapy, the Panchakarma therapy will be in our mind. And this Panchakarma therapy and other therapies combined will contribute by stimulating the muscular system, thus improving both fine and gross motor skills of the patient, thus slowing down further degeneration and providing the longevity. Now I had mentioned about the objectives and approach. Now I'm going to the uniqueness of VIAMS treatment, or how we are managing the Parkinson disease and what is our uniqueness. Authenticity in medicines. Mr. Ritesh Manoharan has mentioned that we had an on-manufacturing unit, which is a GMP and ISO certified. So in that, our own manufacturing, we are privileged to have a GMP and ISO certified manufacturing unit, which enables us to make the customized herbal form combinations as per each patient's requirement. Personalized customization. Therapies are molded to suit each patient and ailments. The most important uniqueness is the integration of Ayurvedic medicines and therapies at VIAMS. Traditional and customized Ayurvedic treatment is incorporated with allied healthcare techniques with yoga, physiotherapy, psychology, audiology, speech therapy, nutrition, and dietetics. The faultless approach. We keep 360-degree focus on patients and their symptoms, by which we can also manage all related conditions. And we have a rich and splendid healthcare tradition, that is our legacy, spanning in 4 generations. Now, coming to the methodology, our methodology, how we are treating a patient. Initially, we are doing it as a 4 or 5 steps. The first is analysis. Then comes the investigations, then differential diagnosis, and finally defining treatment protocol. Now I would like to share more about the methodology of VIAMS. We start with analysis of the patient with traditional and modern techniques. Then we do a differential diagnosis to ensure whether the patient had Parkinson's disease or any other similar neurological problems. We will then diagnose the neurological condition and then move to a defined treatment protocol. The most important and effective analysis is the interaction with the patient, which states in Ayurveda as Darshana Sparshana Prashnehi Pariksheda Charoginam Rogam Nidana Pragrupa Lakshano Upasayaptibi, which is visual analysis. That is Darshana, known as Darshana Pariksha. Darshana Pariksha includes observation and inspecting a patient, that is, inspecting the skin, behavior, eyes, etc. Next comes this Sparshana Pariksha, that is the physical analysis. Sparshana Pariksha includes physical examination such as Nadi Pariksha, that is pulse diagnostics, palpation, percussion and auscultation. Next is Prashna Pariksha, that is the question and answer session, where the patient is asked about the symptom and the medical history, lifestyle habits, and other important factors preceding or associated with a particular health problem. And I had mentioned that we are doing the modern investigations also. We are following the UPDRS, that is United Parkinson Disease Rating Scale. We will rate 0 to 4 according to the patient answers, and we will analyze it every 3 months. Coming to the investigations, as we all know, our medical field has, like anything, it has been successful research and so many things are going on. Coming to investigations, CT scan, MRI scan, positron emission tomography, that is positron emission tomography, PET scan. There is a nuclear imaging technique which allows in vivo estimations of important physiological parameters such as glucose metabolism and neuroreceptor binding, enabling greater understanding of the pathophysiology of Parkinson's disease. The next is levodopa drug challenge test, that is the Troden scan, which binds to the dopamine transporter, could be used to image the dopaminergic system in the diagnosis of Parkinson's disease. Coming to the differential diagnosis, there are so many neurodegenerative diseases, as Parkinson's disease is also a neurodegenerative disorder. Normally the patient comes, whenever the patient comes to see me, they will say, "Doctor, I am having Parkinson's." So I'll ask them, you leave that you are having Parkinson, you just share me what are symptoms you are having. So we can easily differentially diagnose whether the patient is having typical Parkinson's disease or any other disorder. They may be Parkinsonism, Alzheimer's, PSP, that is progressive supranuclear palsy, XDP, dystonia, multiple system atrophy, that is known as MSA, then MND, that is motor neuron diseases, ALS, amyotrophic lateral sclerosis, then different ataxias, that is cerebral and cerebellar ataxias, then OPCA, oligopontocerebellar atrophy, that is OPCA, dementia, chorea, tics, writer's cramp, so many neurological conditions are there. So, as I had mentioned some names of the neurological conditions. Let us see how Parkinson's disease is different from progressive supranuclear palsy, that is PSP, that is a common. If the patient is having a typical Parkinson's disease, the patient will be having tremors. But if the patient is having the progressive supranuclear palsy or PSP, the patient will not have tremors. In Parkinson's patient, the patient will have imbalance to any parts of the body, forward, backward, left or right. But in PSP patients, they have the imbalance only to back sides. And with different from Parkinson disease, the PSP patient, in the PSP patient, the eyeballs will be restricted. Severe dysphagia, that is difficulty to swallow, will be there, and speech difficulties will be there. And most of the PSP will be the dementia will be the initial symptom, and then comes to PSP. Let's take another disease, that is dystonia. What is dystonia? In dystonia, the patient will not have a typical tremor, but the abnormal muscle movements will be there in dystonia, and severe imbalance will be there. Dysphagia will be there. Walking difficulty will be there. Then coming to the multiple system atrophy or ataxias, cerebral and cerebellar ataxias. If the patient is having cerebellar ataxia other than Parkinson's, the patient may have difficulty, imbalance difficulty to mainly to backside. And in those cases, the patient will not have any tremors, but movement difficulty will be there. And another major neurological condition is movement disorders. In movement disorders, how Parkinson's disease is different from movement disorders? Almost all symptoms will be same, but in movement disorders, there will be no tremor. Almost all symptoms will be same. Even the motor, cognitive, and sensory will be same, but there will be no tremor in motor in movement disorders. Next is diagnosis. So after this analysis, looking to investigations, differential diagnosis, we will come to diagnosis. Whether the patient will have the cardinal symptoms I had mentioned in my earlier slide, that is tremor, rigidity, echinacea, and postural instability, we can confirm it as a typical Parkinson disease, or else we will go to the differential diagnosis and we will find out the exact cause of the disease, and we will diagnose it properly, and we will define. The next is defining treatment protocol. The treatment protocol is individualized as per the condition and nature of the patient and the progression of the disease. We don't have a fixed treatment protocol. After seeing the patient, after consulting the patient, after the Darshana Sparshana Prashne, we will define the treatment protocol. So that treatment protocol, the key treatment protocol, includes internal medicines, external therapies, and allied healthcare techniques. Internal medicines includes, or internal medicines are aimed at improving nerve and muscle strength, cognitive ability, as well as regeneration of atrophied cells. Decoctions, medicated oils, medicated ghees, herbal powders, tablets, customized metal and mineral preparations, etc. are the main internal medicines used in the treatment of Parkinson's disease and all neurological conditions. Coming to the external therapies, Panchakarma therapies meant for the purification and regeneration. This Panchakarma therapy will help to improve muscle strength, tone, and bulk, as well as improving cognitive and sensory functions. The most important, the integration of allied healthcare techniques. In our hospital at VIAMS, traditional and personalized Ayurvedic treatment is incorporated with allied healthcare techniques with yoga, physiotherapy, psychology, audiology, speech therapy, nutrition, and dietetics. Now, I will detail what is the importance of the integration of the allied therapies? We will start with the integration of physiotherapy. Regular physical exercise can be beneficial to maintain and improve mobility, flexibility, strength, gait means walking, and quality of life. Physiotherapy can help with movement and balance problems. The physiotherapist, most of the patient will have muscle stiffness, rigidity, walking difficulties, imbalance problems. These problems we overcome with the help of the physiotherapy department. Next is psychology. If the physiotherapy department help for the improvement of our motor functions, the department of psychology or the integration of psychology or the clinical psychology will help the improvement of the cognitive symptoms. Our psychologist assesses individuals to diagnose their cognitive, emotional, and behavioral disorders and treat using variety of techniques, including cognitive behavioral therapy. This will definitely help the patient to improve their self-esteem, to get rid of the unusual fears, to improve their sleep, to get rid of higher mental tensions, anxiety, anger, and emotions. We provide an unparalleled and important counseling session to patient and to the bystanders, that is a family therapy. Coming through the integration of ASLP. ASLP means audiology and speech language therapy or audiology and speech language pathology. The ASLP specialist assesses, diagnose, and treat speech, language, social communication, cognitive communication, swallowing difficulties, hearing, and imbalance problems. Already we had discussed in the sensory and the cognitive function symptoms. The patient, the Parkinson's disease patient, will have imbalance problems, that is mainly because of the vertigo. They have the difficulty to speech. There will be very unclear speech will be there, or the volume will be very low. There will be monotonous speech will be there. Dysarthria, that is difficulty to speech. This difficulty to speech and dysphagia, that is commonly seen in dystonias like cervical dystonia, oromandibular dystonia. These are so many neurological conditions which I have never touched in this presentation. These oromandibular dystonia, cervical dystonia, dysphagia problems, dysarthria problems, imbalance problems, we can improve with the help of the ASLP specialist. The next is the integration of nutrition and dietetics. We have observed that the absorption issues of the neurological condition patients or the neurodegenerative patients can be resolved with the help of a nutritionist. In neurodegenerative patients, the food what we take will not absorb properly, and as a result of that, they will be having lack of vitamin D, vitamin B12, etc. So the dietitian assesses individuals' food and nutrient intake, their lifestyle and medical history. Their advice can contribute to the improvement of Parkinson's disease symptoms and increase health-related quality of life. Planning of a balanced diet based on periodical nutritional assessments is essential because Parkinson's disease patients present with gastrointestinal dysfunction leading to constipation and gastroparesis, that means food remaining in the stomach for a longer period than normal. Diet planning is also needed to maintain nutritional levels by avoiding weight loss or gain. Coming to the last integration, what we are doing as of now. In future, we are planning to integrate some more like music therapy, etc. So, coming to the yoga and meditation. Yoga is the science gifted to the world by primordial Indian culture. Yoga aims to unify body and mind by combining respirational and physical exercises. Yoga enhances body movements, cognitive and behavioral problems. More than being a mere exercise regimen, yoga aims to coordinate bodily functions with that of the mind. Various yoga techniques helps in maintaining peace, confidence, and happiness to the mind, while helping to increase flexibility, reduce muscle spasms, and ultimately leading to an improved quality of life. I'm moving to the conclusion of this webinar. And in that conclusion, I would like to start with the mitigation or management, the VIAMS method. Alleviation of exaggerated doshas with customized internal medications or formulations, and cleansing the body with panchakarma therapies. That means complete purification and removal of toxic substances from all the dhadus. Dhatu is an Ayurvedic term. The English term is tissues, the body tissues. Improve the core muscular functioning and imbalance through physiotherapy. Psychology counseling assesses and treat emotional, cognitive, and behavioral problems. ASLP specialists assess and treat person's speech, language, and hearing problems, rekindling the vigor of the body and mind through yoga and meditation. Parkinson's disease cannot be prevented, but the progression of the disease can be halted. Some of the measures to stop the disease progression include lifestyle modifications, mainly be active as possible. I had mentioned the dopamine in my initial slides. The dopamine will be produced if we are happy. If we are feeling sad, the dopamine will not be produced. And this dopamine is responsible for the voluntary action of body and mind. So, always be active as possible. Dietary modifications, that is, usage of old rice, wheat, citrus fruit, vegetables, nuts, milk and milk products, pomegranate, lemon, mango, orange, guava, apple, peach, garlic, asafoetida, sprout, etc. And avoid barley, arecanut, jamon, excess protein diet, hot, spicy food, and incompatible food articles. People who eat more fruits and vegetables, high fiber foods, fish, omega-3 rich oils, and who eat less red meat and dairy may have some protection against Parkinson's disease or any neurodegenerative disorders. Antioxidants such as vitamin C and D are protective against the disease. Consumption of more vitamin B12 would help people battling Parkinson's. Calcium and vitamin D supplements help for bone health, as the patient have an elevated risk of developing fragile bones and fractures. Practice regular aerobic exercises. Reduction of stress through yoga and meditation. Environmental modifications like avoiding overexposure to harmful chemicals, either at home or work. Even if you are exposing to any chemicals, do wear proper mask or proper gears. Consume antipsychotics or any other medication under close supervision of your doctor only. Let's come to the conclusion of this session, of this webinar. Parkinson's disease is a disorder with no established cure. Ayurveda has shown that it has a better success rate than any other systems of medicine while dealing with any degenerative disorders, not only brain degenerative disorders, any degenerative disorders, I repeat. Similarly, it is considerable potential in dealing with neurodegenerative disorders is yet to be properly tapped. Parkinson's disease does not affect the lifespan of the patient, but it affects the quality of life. Parkinson's disease is known as a socio-economic disaster. It will harm our social life and our economic life. Parkinson's disease patients' family members give extra help and support to stay and preserve their quality of life. At VIAMS, in our hospital, we aim to properly treat and document each of these cases with the ultimate aim of bringing Ayurveda into the mainstream medical discussions. We had already documented around 3,000 different types of neurodegenerative cases in our hospital. Yes, we can control Parkinson's disease. Thank you. I will end up with this session with a positive quote. Sarve Sandhu Niramaya. Let all be healthy. Thank you all and namaste.
Thank you very much, Dr. Vijit, for the wonderful section. It's time for question and answer section. Kindly raise your hands or directly ask in chat.
Hello, sir.
Yes.
Good evening, sir.
Very good evening.
It was my name is Dr. Isra.
Yes, sir.
I'm from Calicut. I'm
Yeah.
from Calicut, sir.
Okay.
Okay, as sir, your session was very informative, and your ideas on how it is a Vada Vyadhi and the reference from Basavarajyam was also interesting. So, can we consider it solely as a pure Vada Vyadhi? What about the association of the other doshas, Kapha dosha and Pitta dosha in the disease?
Yes, Kapha and Vada. Mainly Kapha is predominant, and along with Kapha, along with Vada, Kapha is also there. That is Tarpaka Kapha is there.
Okay, so
Doctor, actually this session is not only for Ayurvedic doctors. That's why I mentioned generally only. I try to use very less Ayurvedic terms actually.
Okay, sir. Thank you.
No.
So one more doubt. So it is actually very interesting to know that you have treated more than almost 3 generations of patients affected with neurodegenerative conditions, and they are coping with life in a positive manner. So have any papers been published in this regard, scientific papers, so that we can go through?
Yes, we are preparing that. We will be publishing soon. Our publication department will be working. Publication department is working on it, and we will publish within no time, maximum of 3 months time.
Okay, sir. Happy to know, sir. Thank you.
Thank you, Doctor.
Sir?
And Paramjit Singh, hello, sir. Are you here?
Yes, sir. Yes, sir. I'm here.
How are you, sir?
So nice to see you. This is really very good presentation, and I really love it. Whatever information you're providing is really wonderful, wonderful.
Thank you.
Or
And
today,
you told
this is my first time experience with this kind of seminar.
Estonia.
Yes.
Yeah, as we all know, those who are attending this webinar, the Paramjit Singh and Manjinder is my patient for last 3 years, and they are right now they are in Canada. They are attending this session from Canada. And Paramjit sir, initially she's having exactly that movement disorder, and the medicine is exactly what we are providing to Manjinder, and that is having an exact response. And the last week we had a consultation, and at that time I'm sharing the thought with Dr. Needu that Manjinder is having some dystonic moments also. So actually, I had already added the medicines for the dystonic moments. The medicines will be reaching in Canada within, I think, within 3 or 5 days.
Yeah, that's good.
Okay.
That's good. That's my question. This is from your today's seminar. I learned that maybe the symptom you are saying you are told about this dystonia mostly related to Manjinder. Manjinder condition is the same like with the symptom of dystonia. That's why I asked. And,
Yes, sir. You had
right
sent
path.
me a video of that Manjinder, and I had discussed with Dr. Needu that Manjinder is having some dystonic moments. So, and I had added the medicines for dystonia. Nothing to worry.
Okay. Thank you, sir. Thank you very much.
Okay, thank you.
You're doing great. You're doing great there I can say for mankind, you are doing really great job, and keep it up.
Thank you, sir. Thank you very much for your kind words. Yes, sir. Vichara Bindu. Namaste, sir.
Namaste.
Namaste.
Hope we had an interaction last week. My real name is Sri Kumar. I interacted with you for my knee problem.
Okay.
And you asked me to send my X-rays also.
You're from Trivandrum?
Yeah, I'm from Trivandrum.
Yeah, I remember you. I remember you.
That Bindu is my Brahmacharya Diksha name.
Okay.
Now, one of my uncles, who is no more now, was suffering from Parkinsonism.
Okay.
And of course, now, as you told me in the beginning of your talk, you told me the amalgamation or the union of the mind and the body.
Yes.
Is the most important thing where happiness generates for the first time.
Exactly.
But when I used to give lectures on that matter, Jivatma Paramatmanor Aikyam Yogaha. Okay.
Yeah.
So that is metaphysics. In metaphysics, it is said that that is very much important. But people who are on the way of amalgamation from the body consciousness to the universal consciousness,
yeah,
a little transformation happens, and some of those people just fall off to this particular disease known as Parkinson's.
Yeah.
For which I think you will be having a good research institute in your department.
Sure, sir. Sure.
And I would like to send some of my such pinpointed patients to you.
My pleasure, sir. My pleasure.
But this COVID problem, that does not allow them to just come over to you. They will be interacting with you on the phone that through which we had interaction last time. And it will be a great help for them because they are on the way. They are on the journey from body consciousness to the universal consciousness.
Okay.
And in the way, in the middle of the journey, they get distracted, and most of them go to this disease known as Parkinson.
Okay.
Please be kind enough to hear them and give them good suggestions and good advices.
Sure, sir. Definitely, I will do, sir. Thank you. Thank you for your kind words.
Thank you very much.
Okay. Dr. Sharanya, any more questions to answer?
If anyone have any queries, they can ask.
If you have any queries, you can raise your hand and unmute yourself and ask.
Hello.
Yes.
Good evening, sir. I'm Naveen Chabra speaking from Indore.
Tell me.
So my daughter, she's 4 months old, and after her birth, after 6 days, she got a jaundice, and her bilirubin level was on that time 28.5.
Okay.
Um, then she got admitted in NICU, and several procedures was going on that time. And doctor said, "Okay, after 3 months we have to go for a BERA test." After 3 months, we went for a BERA test, and she diagnosed with the auditory neuropathy.
Auditory.
Right now, her coordination and yeah,
Okay.
her eye contact, her gargling sound, chewing sounds, all are perfect, but her OE report is completely okay. Her BERA is completely positive.
Okay.
So in allopathy, there is a no treatment, as we know. I'm a physical therapist by profession,
Oh, that's
and like I already postgraduate in neurology, and I treated number of cases like these type of kind of cases like developmental delay and the Parkinson's, everything that the cases you right now you discussed here.
okay.
But for auditory neuropathy, like we don't have any answer what to do.
Okay. So, what was the final diagnosis?
Auditory neuropathy,
Auditory
and that
neuropathy,
is
that
due
is the
to
final
a,
diagnosis. Okay.
according to audiologist, there is the deposition of bilirubin over the synapse in between the cochlear nerve and like cochlear end plate and nucleus. So
Okay.
he said there is a mild delay in the conduction of like sound to auditory cortex.
Uh-huh.
Understanding the pathology and everything, the doctors unable to treat her since they were saying we have to wait and watch till
And,
1 year.
and
Otherwise, we have to go for a cochlear implant.
okay, your baby is just 4 months of old, right?
Thank you.
Your baby is just 4 months of old. Am I right?
Yes, yes, sir.
Okay. See, normally in auditory neuropathy cases, we suggest hearing trial on the cochlear implant. But in case of speech improvement, it will be very, but this is only 4 years of age. We have to wait for like 2 or 3 years of age. That's my suggestion. But definitely we can go for a auditory verbal therapy and lip reading strategies in later, not now.
Okay.
Along with that, in Ayurveda, we have a specialized department that is Kaumara Bhartiya, that is pediatrics. And we can do something with that pediatric department. We had a consultant here.
Okay.
Okay. So I think you had already mailed me the details of your child. Am I right? Is that you or?
Yes, yes. So my husband talked to your assistant.
Yeah. Oh, okay. Yeah, now I remember. See, we had already discussed your case with my team and my audiologist and other physiotherapists. So what they're telling is, this is just 4 months of old, and you are very far from us. So even we are not seeing the patient. I will do one thing. I will prepare a treatment protocol, Ayurvedic treatment protocol, which includes Ayurvedic medicines and therapies to you. Not now, even after 6 months or by 1 year of age. At that time, we can do some treatment protocol. We can do some treatments.
Why you are delaying the treatment? Like if we are delaying her auditory system, then we have to go for another disorder, that is a speech disorder. So according to me, like if there will be a treatment, there will be any earlier treatment, then
yes,
we do not go for any speech therapy and all.
Yeah, I'm completely aware of your concern. In this stage, we can provide only some medications, not extended therapies we can't do. So that internal medicines, I will discuss with the consultant of the pediatric Ayurvedic pediatric department, and I will send you an email and a treatment protocol within 1 or 2 days. I think Mr. Arjun is in contact with you.
Anji?
I think Mr. Arjun is in contact with you. Am I right?
Yes, sir. Yes, thank you.
Yeah, Mr. Arjun will call you tomorrow morning and give you a detailed reply. Along with that, I will prepare a treatment protocol. What all things we have to do at this age, I will discuss with the pediatric department, and I will let you know the details.
One last question, sir.
1 or 2 days maximum.
Hello.
Give me 1 or 2 days. I will send you a detailed report.
Okay, sir. Okay, sir.
Okay.
So one last question.
Yeah.
Do you ever see these kind of conditions, like whether auditory neuropathy is recoverable? Is it possible now, sir?
Yes, we had treated some similar cases. We had treated similar cases, but not this much early stage. By 1 year, 2 year, in that age, we had already treated some cases.
Okay.
Okay. Thank you.
Thank you. Thank you, sir. Thank you, sir.
Anybody?
Is there anyone else have any questions?
Okay, Dr. Sharanya, if there is no questions, we will end up the session.
Okay.
Okay.
Thank you all for the participation. We hope that the section was useful and we could cover all the queries. Let's wind up, and we welcome you to VIAMS to have a healthy and peaceful lifestyle. Thank you, Dr. Vijit, Dr. Neetu, Mr. Ratish Manoharan. Thank you all.
Thank you all. Thank you and good night all. Bye. Take care.